The Clinical Incident Investigation process is set out in the WA Health Policy on Clinical Incident Management, with additional details provided in the Clinical Incident Management Guidelines and Toolkit. The Clinical Incident Investigation process can be broken down into 6 key phases. These are the initial identification that an incident has occurred and notification of the incident into Dartic SIMS. Then a process of analysing what went wrong and why, and making recommendations to improve our care. Then reporting the outcomes from the investigation, closing the loop, and the ongoing review of risk. Let's look at each of these in turn. The first stage of clinical incident management involves identifying that a clinical incident has occurred. A clinical incident is defined as an event or circumstance resulting from healthcare provision, or lack thereof, which could have or did lead to unintended or unnecessary physical or psychological harm to a patient. A near miss is an incident that may have but did not cause harm, either by chance or through timely intervention. We use a rating of potential or actual severity of harm to the patient in order to classify clinical incidents. There are 3 levels of severity, or Severity Assessment Code ratings, SAC. SAC 1 are incidents that have or could have led to serious harm or death. SAC 2 have led to moderate harm, and SAC 3 only minor harm or no harm at all. The next stage of clinical incident management involves notification that an incident has occurred. Notification of a clinical incident is made via an online clinical incident form completed within Dartic SIMS. This is WA Health's system for clinical incident management. Any staff member can notify that a clinical incident has occurred, and notification can be done anonymously. There are some key timeframes involved in the notification process. These include, firstly, informing relevant management involved that a clinical incident has occurred, and following any other local processes as soon as possible. Secondly, documenting a summary and any essential information and any actions taken in the patient's medical record by the end of the notifier's workday or shift. Thirdly, making the formal notification in SIMS, also by the end of the workday or shift. And finally, within 48 hours of the notification, the relevant staff member involved in the management of the clinical incident, such as the unit manager, will undertake initial analysis and confirm the SAC rating of the event. If the event is confirmed to be a SAC 1 clinical incident, notification must also be made to the WA Health Patient Safety Surveillance Unit, the PSSU, within 7 days. Next comes the investigation process. We look at this in more detail in other videos, but the basic process involves developing a timeline of events and an understanding of why those events occurred, and then recommending changes to the way in which we do business to ensure the clinical incident will not happen again. For SAC 1 clinical incidents, the investigation is undertaken by a small group using a rigorous investigation methodology with the assistance of a facilitator from the Safety and Quality team. A SAC 2 clinical incident requires a clinical review or investigation with another appropriate methodology, and SAC 3s require an investigation using an aggregated analysis or other appropriate methodology. Your local clinical risk coordinators from the Safety and Quality team can provide guidance here and are a great resource. Once the investigation is complete, there are requirements with respect to reporting the outcomes of the investigation and also the actions that have been planned in the form of recommendations from the investigation. Final SAC 1 investigation reports, including their recommendations, must be endorsed by the Chief Executive or equivalent with approved delegation. Once endorsed, SAC 1 investigation reports must be submitted to the PSSU as well as finalised within Dartic SIMS. This needs to occur within 28 days of notification of the incident to the PSSU. For SAC 2 and 3 clinical incidents, the report in SIMS needs to be completed within 60 working days. The clinical incident investigation process does not end with submitting the final report. The next stage we call closing the loop, and this means that the lessons learned from the incident are translated into improved clinical practices and enhanced patient safety. A big part of closing the loop is implementing the recommendations from the investigation and also evaluating the effectiveness of the recommendations. Recommendations arising from clinical incident investigations must be implemented and evaluated within 6 months of the investigation report being submitted. Also, linking into the open disclosure process to provide feedback to our consumers and their families, and providing feedback to the clinical team that were involved in and who notified the incident are also an important part of closing the loop. The clinical incident management process needs to be seen as an important part of the cycle of continuous improvement in the safety and quality of everything we do in WA Health. We continually reflect on the improvement we make to our systems, and we need to ensure that we are sharing the lessons we learn across all WA Health services, facilities, and regions.